Hello, everybody. Welcome to the Vitalyst Health Foundation Systems Change Grant Information session. We'll get started in just a minute as we welcome more of our friends from the waiting room. Welcome again. We'll just get started in a moment. Thank you for joining us.
Yeah, I think Naveen El-Kashari is about to join.
Great.
Let's see.
I'm here. Hi.
Okay, great.
Hello,
Naveen.
David.
Welcome. We'll get started in just a moment as we welcome more of our friends from the waiting room.
Perfect. Thank you.
It seems like we have a good amount of folks from the waiting room, so we'll go ahead and get started. Thank you so much, everybody, for joining us. My name is David Martinez, the Director of Grants and Civic Health at Vitalyst Health Foundation. Welcome to the FY 24-25 Vitalyst Health Foundation System Change Grant Information session. To get us started on our hour of time together, I will toss it over to my colleague Sergio.
Buenas tardes, hello everyone. Una de las cosas que hacemos aquí en Vitalyst es que si hay gente que necesita ayuda en español, los podemos ayudar en español. Entonces, si quieren mandar un correo directamente a conversemos@vitalysthealth.org, ahí les podemos responder sus preguntas en español, o también si quieren llamarnos, acá tenemos suficiente gente que hablamos español y les podemos responder sus preguntas.
Thank you so much, Sergio. Additional housekeeping, we do have closed captioning available, so select that option in your Zoom. All lines are muted upon entering the webinar, but at the near the end of this session, we'll allow folks to unmute themselves and do a live Q&A as needed. Also, feel free to use the Zoom room to put your questions throughout the session, and my colleagues will answer those live as we get those. And for those that we can't answer at the moment, we will plug them into the Q&A at the end of it. And all of these slides, this recording, the materials will be sent as a follow-up email to all the folks who registered, and we will post them to the vitalysthealth.org website. So let's get started. So at Vitalyst Health Foundation, our responsive grant-making program is a 3-tiered program focused on coalitions who and their capacity building needs through a technical assistance grant support, a spark grant meant for coalitions that need a bit more planning to spark their concept towards systems change, and then our larger system change grant, which is for those coalitions that are formed, they have planned, they just need multi-year funding to help get their systems change implemented. And that is the grant type that we'll review today, much more in depth, each of the criteria and the process, the logistics for our system change grant application process. If you would like more information about our technical assistance grants and our Spark grants, go ahead and visit vitalysthealth.org and our partnership webpage, so you can learn more about those specific grant criteria. And if a fit with your efforts, you can complete our discovery intake form, which we utilize to discover partnership with any organization throughout the state of Arizona that is interested in discovering or exploring partnership with Vitalyst. And the discovery intake form is also an opportunity for you that are specifically interested in the systems change grant to set up a one-on-one conversation with one of the Vitalyst Health Foundation team members to see if that is indeed a good fit for your, if the system change grant is a good fit for your efforts, and if, and to kind of review the concepts and have a deeper conversation specifically about the systems change grant. But as you'll learn in just a little bit, you do not have to go through the discovery intake process to submit a system change grant application. So what are the system change grants? I know that my slides, especially as we get to the specific criteria for the system change grants, are pretty dense. But one of the things as Vitalyst practices trust-based philanthropy and equitable grant-making principles is being open and accessible. So a concept that you'll hear me say often, and that's reflected in these slides, is the information that you see on each of our slides, the criteria and the specific points for each of the criteria is the evaluation matrix that our grant review team, which is made up of Vitalyst staff members and a grant review committee of our board of trustees, utilizes as we review our system change grant applications. So long as you answer to the best of your ability in your application, the criteria and the specific points that we'll review today, the stronger your proposal will be. So I apologize beforehand for the dense slide decks, but we want to just get you the information and be as clear as possible with the criteria for our system change grants. So as I mentioned, our system change grants is sort of that third tier of our total system change grants program that is meant for coalitions ready to implement their systems change. They just need, again, multi-year funding to help see it through. The system change grant is a 3-year grant of totaling $175,000. So by the end of the grant period, you'll either have fully implemented or made significant advancements to your systems change. We recognize that systems change often takes even more than 3 years. So I think a big piece of the evaluation for our system change grant partners is you don't necessarily have to have implemented fully your system change grant, especially as we know change happens within system change efforts, so long as you have made significant advancements toward your system change. Certainly, we want you to shoot for the moon, even if it's big, hairy, audacious goals that we know systems change efforts can be, but recognize that we recognize that the full implementation of a system change might not be possible within just a 3-year time period, but definitely strive for that goal. And then as we have a system change grant partnership, we can work with you to celebrate your smaller successes leading up to the big success of your total system change grant. Just like all of our other grant types at Vitalyst Health Foundation, the systems change grant has 5 criteria. They are, the system change grants have to be geared towards a coalition working to achieve some sort of health outcome using a systems change approach and a system change lens and a health equity lens. And the proposal has to have a budget that's consistent with the scope of work that is submitted as the application. And it's the system change grant is a 3-year grant totaling $175,000. What does our process look like at Vitalyst Health Foundation? This slide represents the timeline for our system change grant application. It is an annual grant cycle for Vitalyst Health Foundation. As we begin our new fiscal year, July 1, and open up our discovery intake process to discover new partnerships, we begin having conversations with community groups and coalitions that are exploring if the systems change grant might be a good fit. So that discovery intake process is open now and will go up through November when our system change grant application is due. So if you want to have a deeper conversation, certainly look at that discovery intake process to set up a time to chat with a Vitalyst team member to have a deeper conversation. The system change grant application portal opens up next Tuesday, October 1st. So as I mentioned, folks do not have to go through the discovery intake process to submit a systems change grant application. It would help you, I think, strengthen your proposal or really determine the fit, especially with each of the criteria, if you have a conversation with the Vitalyst team member, but it's not necessary. If you're ready, if you're familiar with the Vitalyst Health Foundation Systems Change Grant, go ahead and skip that discovery intake process and submit your application directly to the portal. And we'll, of course, send you the portal link and all of the follow-up materials so you can do that. So again, that portal will open October 1st, and applicants will have through November 15th to submit their application. And the November 15th, Friday, 5 p.m. Arizona time is when our portal will close. Then staff goes into our review and deliberation process of all the submissions for the system change grant applications. That's a multi-step process that involves an initial review of all of the submissions, and then advancing those for that meet baseline minimum criteria for a broader review of both the Vitalyst team and the grant review committee of the Vitalyst board of trustees. So that is a determination process that happens between the portal closing and December 20th, when we notify those that are selected to advance to the next stage of our grants process. And when we will send the initial round of declinations if you are not a semifinalist to advance forward. Once we get through that process, the semifinalists have an opportunity to get feedback from Vitalyst team members on the initial review of your written application, so that you can address any questions that we had through our review of your application, and be in a better position to present your systems change grant concept the week of January 27th, when we set up virtual presentations for our coalition applicants to present their systems change grant process. So there is a written application portion of the system change grant, and then semifinalists are invited to present virtually for their systems change grant process. That is a practice that Vitalyst has followed for several years now, and it's a equitable grant making principle, because we do work with a lot of grassroots community-based organizations that may not have a robust fundraising and development arm, or maybe not even like a grant writer or a grant coach, but they sure do tell their story really well. So it provides that equitable opportunity for our applicants to present their systems change efforts live and in a way that they may be more comfortable with. So there's two components of our system change grant application: the written application and then the virtual presentation. And then after the virtual presentations, our grant review team reviews and scores all of those presentations, and then staff makes a recommendation to our board for ultimate funding, and grant award notifications go out at the end of March. For those familiar with the Vitalyst Systems Change Grant process, you may see, and hopefully you see, that we've worked diligently to try to shorten the amount of our grant cycle. So in this new timeline, we have essentially shaved off about 3 to 4 months from the original or the past system change grant cycles. And that's to be able to be more responsive to your community needs and our partner needs, and again, practice those trust-based philanthropy principles with reducing the amount of paperwork that you have to do to access resources that we have here at Vitalyst Health Foundation. We'll also review a little bit later, but another big thing folks that are familiar with Vitalyst Health Foundation System Change Grants will see is that the written application that is submitted in the online portal between October 1st and November 15th is now 4 pages, rather than a 2-step written application process that we had previously. So again, another attempt that we're making to shorten the paperwork needed from our partners to access the resources. So the application itself, as I mentioned, is a 4-page written proposal. Along with the 4-page written proposal, the application submitted on the online portal will include a summary of a Wilder Collaborative Assessment, which is a tool that we use to measure coalition readiness and strength. The letters of commitment from each of the core partners of the coalition that is submitting for the submitting the application, a budget spreadsheet utilizing a template that we have developed and will provide to you. And then if invited to the semifinalist round, there is the presentation component of our Systems Change Grant application. I'll review the more specific angles of each of these components, but in totality, the first phase, the written application, includes that 4-page written proposal where you'll have an opportunity to provide a narrative on how your project hits each of the 5 criteria areas. The summary of the Wilder Collaborative Assessment you'll upload to the portal, uploading letters of commitment from your core partners of your coalition, and then uploading your budget spreadsheet. So there are basically 4 components of the written application submission. We'll send the link formally to you afterwards, and in the materials that will be posted, a little submission how-to guide to help you navigate the online portal, which you'll have the opportunity to review starting on October 1st, and again, have until November 15th to submit your written proposal on that link that's shared as well on this slide for the online portal. So now let's take a dive into each of the 5 criteria of our Systems Change Grants. So the first criteria is you have to have a coalition. This is and a really important aspect that Vitalyst has supported coalitions, because we know that systems change is it takes a village. It's a lot of work, it's heavy work, and not one organization alone can achieve the type of systems change that we hope to see in Arizona and throughout our ecosystem. So the coalition criteria is a really key aspect of the Systems Change Grant for Vitalyst. The coalition at minimum has to have at least 2 organizations that are serving the state of Arizona. The lead applicants, so of the coalition, the group that is actually submitting the application on behalf of the coalition has to be an Arizona serving nonprofit or fiscally sponsored organization. As a nonprofit, that also includes governmental institutions like universities, community colleges, city, state, county government institutions as well, well, maybe not state agencies, but city departments and whatnot are included in that umbrella as well. Your coalition is already formed. You have built your capacity. You've really done the planning towards systems change. You all are really ready to achieve the systems change that you hope to achieve. All the necessary partners are around the table already, and you have identified the specific roles each one has to help achieve the systems change you have. This is a really important aspect of it, because a coalition really is made up of all of those necessary partners that, again, will have specific roles to help you achieve your systems change. The coalition should have some sort of history of working together, because, again, if you reflect on the total, the different types of grants Vitalyst has, technical assistance grants are meant for coalition capacity building, SPARK grants are meant for coalitions and their planning needed. And then when you're ready for the systems change grant, the coalition is formed, you've done your planning, you just need multi-year funding to implement your systems change. That's really what we want you to focus on. If your coalition is not yet formed, you still need capacity building support, we're going to recommend that you explore receiving a technical assistance grant, not yet a systems change grant. Or if your coalition hasn't yet identified the specific interventions or solutions towards systems change, we're going to recommend you explore the SPARK grant opportunity. So coming back to the systems change grant piece, this coalition is formed, it's built, it's cohesive, you're just ready to implement your systems change. And those are, again, the specific points that our grant review team is looking at when evaluating the coalition of your systems change effort. We utilize, as I mentioned, two different additional aspects to measure and assess the strength of your coalition. That is the Wilder Collaborative Assessment. The Wilder tool is a tool that Vitalyst has used for several years now as part of our Systems Change Grant applications. So if you're not new to Vitalyst, you should be familiar with this. It's an open source assessment tool that anybody can access through the wilderresearch.org website. There's a link there. And again, we'll send a follow-up and post all of these links with those materials. And this is an open source tool that any coalition can utilize to assess the strength and the readiness of your coalition. So with your application, as you begin to draft your 4-page proposal, also go to this link with Wilder Research to register a group. This is your coalition. And once you register your group, you will receive a unique link to then send to all of your core partners. And all of your core partners will answer this Wilder Collaborative Assessment. And once all of your core partners have completed the assessment, you as the lead applicant that registered your group, that registered your coalition, will then receive a summary document of all of those submissions, all of those individual submissions. And that summary document is what you will upload to the online portal once you're ready to begin to collect those components of your written application and ultimately submit your proposal. So that is the Wilder assessment. The key piece to this is all of your core partners should be completing the Wilder assessment. Remember, a coalition is 2 or more partners. So if you have 2 partners, we expect at least 2 Wilder assessment reports from each of those core partners. We're really looking for quality over quantity. So really think about who are those core partners who have specific roles and responsibilities that are helping you achieve your systems change. And that's who we want to complete the Wilder assessment. The assessment is about 40 to 45 questions long. So it's a little bit lengthy, but it's pretty easy to run through. And if your team allocates, if each of your core partner allocates between 15 to 20 minutes, they should be able to complete it. So again, each of your core partners will complete the Wilder assessment. And once they've all been submitted, and you can be notified and download the summary page, which is what you'll upload to the online portal. So that's one additional document that you'll upload as part of your written application, and one of the 2 components that we assess your coalition. The other is the letters of commitment, or LOCs. So these are letters that you will receive from each of your core partners. Again, that core group of your coalition that have specific roles in your coalition to help you achieve the systems change. And as you collect those, you'll collapse them or compress them into one PDF and have the opportunity to upload those as part of your written application as well. An important aspect to note with the letters of commitment is letters of commitment differ very greatly from letters of support. It's great if you have support from other community partners, organizations, governmental institutions that may influence or have some sort of connection to your systems change efforts. But the letters of commitment are from your core partners of your coalitions. And in that letter, it will outline their commitment to the effort, highlight their specific roles and responsibilities as part of the coalition, and provide an opportunity to reflect on your Wilder collaborative assessment, especially if in that assessment there might be some kind of opportunities for growth for that coalition. And if that happens, that's completely okay. You know, not every coalition is 100% strong or perfect all the time. Coalition work is really hard and challenging, but you have an opportunity, your partners have an opportunity to reflect on that a little bit more in their letters of commitment. Another thing I'll note with the letters of commitment, and you can do an easy internet search for letters of commitment or the difference between letters of commitment and letters of support to really see what kind of different templates and whatnot we're looking for as far as letters of commitment goes. However, they really should be individualized, personalized letters of commitment from each of the core partners. If you just have a template letter for each of your core partners, that's not really providing us a great kind of image or perception of the strength of your coalition. So it shouldn't be just template emails that you're having each of your core partners sign. They really should be personalized, individualized to reflect how each individual core partner is engaging and playing a key role as part of your coalition to achieve systems change. So coalition was the first criteria for our system change grant. The second criteria is that coalition has to be working to achieve some health outcome. We are a health foundation at Vitalyst, and our mission is to improve the individuals and communities throughout the state of Arizona. So we want our grant to support those efforts as well. Health outcomes for the criteria of health outcomes are measured by the coalition identifying a community health issue that you're hoping to impact. Even though we are a health foundation, Vitalyst sees health as more than just health care. So we can certainly accept proposals that focus on kind of the more disease-oriented aspects, but we also look at the broader social determinants of health. And as many folks are familiar with, the elements of a healthy community, or the wheel, that Vitalyst has promoted for the past decade or so, and we'll reflect on those in just a little bit more. So how your effort has identified a community health issue and has focused on the intersectionality of each of those elements of a healthy community, because we know that the social determinants are all connected. There's intersections between the elements of the healthy community. So how does your effort in health outcome achieve those intersections? And then in your 4-page proposal, as you reflect on the health outcome you're hoping to achieve, the write-up should clearly explain how the proposed change will positively impact community well-being. And again, we see this as very comprehensive. So we know that 80% of health factors are beyond just healthcare. They're health behaviors, the physical environment, socioeconomic factors. So all of those components can be measures of health outcomes that you're hoping to achieve. You can also reflect on the elements of a healthy community wheel. And again, we'll share more information about that, because each of these spokes of the wheel outlines different categories and specific health outcomes for each. But again, how is your effort towards health outcome intersecting between a variety of these elements? And then Vitalyst has been doing a lot, holding an equity lens in our work with outreaching and building relationships with the tribal communities throughout the state. So we have worked with the Intertribal Council of Arizona, or ITCA, to reflect the will and the elements of a healthy community, but in elements of a healthy tribal community. So if you're doing work with tribal communities, the tribal will might be a good resource for you as we reflect on the specific health outcome hoping to achieve with our great tribal brothers and sisters. So the criteria, again, systems change grants is meant for coalitions to achieve a health outcome using a systems change framework. This obviously is a big criteria as part of our grants because they are the systems change grants. So the third criteria that you'll have the opportunity to reflect on in your 4-page written proposal is how your efforts has a systems change focus and a systems change lens. This is a really key component, because if it is not the more explicit types of systems change, it is really, really important in your proposal to best define how your effort falls within a systems change and is not simply beginning or expanding a programmatic or direct service opportunities. With my colleague Sergio, as you heard from the beginning, we've been undergoing a series of systems change webinars and promotions to better clarify what we mean by systems change, because this is such a key criteria of our grants program, and because we want more groups in the ecosystem throughout Arizona to think about systems change approaches. So this is a really important systems change, and it's really important that in your application, you really have outlined and shown the readiness and the kind of to implement your systems change efforts. So again, this is really the criteria we're assessing is just the coalition has demonstrated that the planning is already done. If you need more planning, that's what the Spark grant is for. So we would recommend you get the Spark grant if you're not yet ready to kind of implement a systems change. This also criteria is that you might the effort is really well thought out, and the coalition partners are the right partners to help achieve and make significant advancements towards a systems change. In your proposal, you really should describe how you anticipate achieving the system change. So that process is really clearly described. Again, the readiness of the coalition to implement the system change, especially because, as I mentioned, system change work is really hard. It really is this kind of big, hairy, audacious goal, but we're not risk averse. We know oftentimes we want to shoot for the moon. We want you to shoot for the moon, but really we need to see the readiness of your work to achieve and embark on the systems change. The systems change solution is more project oriented, and systems change in and of itself is a sustainable solution in that when the system has changed, no grant funding or no funding is necessarily needed to sustain the work. It's sort of like a light switch, right? Once the system has changed, the light turns on and hopefully we see the good. This is really important because system change efforts are often project oriented, they're time bound with a certain outcome. And this is a big test to determine if your effort is actually systems change or more programmatic. So if your effort it needs ongoing funding or it's not time bound, then it's likely programmatic work, which is misaligned with the systems change criteria and our systems change grant. So to help you think through more about what the heck systems change is, and is our work that we're doing actually systems change, as I mentioned, we've done our best and we continue to outreach to partners and have conversations about what we mean by systems change to better help folks understand what systems change is. So we've developed with our partners at FSG a Spark report that goes more in depth about the components of systems change. We also partnered with FSG once again and hosted the keynote session at the AZ Impact for Good annual conference. We captured that keynote presentation for those who weren't able to make it in person. So you can take a look at that on YouTube. And then we just hosted another webinar with FSG to go even deeper about the specific conditions they see of systems change. That's been recorded and posted on our social media channels as well. So again, we'll post all of these links and follow-up materials. But if you're really unsure if your effort is system change or not, reflect on these materials and feel free to schedule a time to chat with a Vitalyst team member using the discovery intake process. This is a really great visual that reflects what systems, the different conditions of systems change are that our friends at FSG has compiled. Systems change work is very big and massive and complex, so it's hard to even reflect on it in this inverted pyramid. However, this is a really great visual because it shows the different conditions or types of systems change that that we have the opportunity to achieve. And some of those are more easy to see. They're more explicit. Those are the structural change pieces that you see on the top, the policy, the practices, the resource flow changes. Those are types of systems change that Vitalyst has supported in the past certainly the policy and practices. For instance, one of our past successful system change grant partners, Sonoran Prevention Works, led a coalition to repeal the state policy prohibiting syringe access programs in the state of Arizona as a well-documented, safe public health harm reduction measure. So they focus on the policy aspects of it, and their ongoing work is really focused on the practices and ensuring that public health departments and other partners throughout the state better understand harm reduction practices and syringe accesses. So policies, practices, resource flows are those easiest to show. It's when you start to get to those semi-explicit and the implicit conditions of systems change that are still inclusive of systems change, but they're a little bit more difficult to show. And that's where in your 4-page narrative, as you reflect on the criteria of system change, it really is important that you define your efforts as clearly as possible, especially again, if it's the conditions around relationships and connections, the power dynamics, the mental models, because again, those are really harder to see. They're not as tangible as like a policy change, a state law or city ordinance or something like that. But Vitalyst has supported efforts that focus on those conditions as well. We have a great partnership with Boys to Men Tucson that in totality is looking at this concept of toxic masculinity. And that's a mental model change, right? Changing hearts and minds around how young men and older men interact, this intergenerational mentorship opportunity to change this mental model around toxic masculinity. There are, of course, connected with other conditions of systems change, but that is in totality the transformative change that they want to make. So you can see that there have been approaches to attack systems change potential by addressing one of these conditions, and that's okay. But systems change in totality should reflect each of these 6. Your effort might not touch on each 6, and that's okay. But the system change potential is transformative. It includes all 6. So let's take a deeper dive into what this can look like. So as I reflected on the structural change conditions, those are a bit more explicit, easier to see. The policies that we see happen and change through law or ordinance at the state, at the city level. There have been other systems change grant partnerships that have been successful that have actually tackled government regulations at the federal level. Our good friends at Feeding Matters led a coalition to implement systems change at the federal level and continue to do their great work to implement the practices that need to change with the health sector to better reflect that policy change, which was really awesome. A lot of opportunities to reflect on resource flows. This has been really, really instrumental systems change because a systems change that we have seen is access reimbursement for critical services that aren't directly connected to healthcare. Access, of course, being our state Medicaid system. So for instance, certain mental health services provided to students and youth at school can now be reimbursed by Access. Certain aspects of housing can now be reimbursed through Access and their Housing and Healthcare Opportunities or H2O program. So that would be a resource flow condition, including in systems change, something that we see and a lot of here at Vitalyst and that we can explore through our systems change. And then again, you get to these relational change conditions, relationships and connections between systems players. Of course, systems change is sort of like a net, a whole web of levers that if you change one, each different one changes. So how can those relationships and connections be changed to improve the system? And a big piece of this is obviously those power dynamics. And this is a really key component as well when you're reflecting on your systems change. Usually there is a decision-making power who has authority or influence or the final say, the ultimate power to really change systems. This could look like a lot of things too. So again, an easy way to see it is if you're attacking a systems change through policy. So if you want to change the law in the state, you have to go to the state capitol or at the local level, at your town council or mayor and council. But there ultimately is a power, a decision-making power that you should focus on in your systems change. And then the transformative systems change potential, of course, is these mental models, these really, the ability, the necessary factors of changing hearts and minds that ultimately impact one's actions. Again, that seems really audacious, and it's okay if your effort is tackling that truly transformative systems change by changing mental models. And these efforts have been seen again through some of the Vitalyst Health Foundation previous grant participants. So that covered the third criteria of our systems change grant. The first one being a coalition working to achieve the second criteria, some health outcome, using the third criteria, a systems change focus. The fourth criteria of our systems change grant is that the effort has to have a health equity lens. This can be seen in a lot of ways, but we know that those closest to the problem should be closest to the solution. So that is an easy measure of health equity, and it's something that should be done at the very beginning of your systems change grant efforts. This can also be reflected in a lot of ways, and really important if the lead applicant is a more institutional partner, like a governmental institution or a university or college department. We really want to see that those with lived experiences have a specific role and responsibility in your coalition to help you achieve your systems change. So this health equity criteria can best be met by showing that, and it could be reflected also in your budget, because we know that to engage lived experiences, there are often necessary components to cover childcare or provide community honorariums or stipends to ensure those voices are respected and compensated. This can look like a lot of different things, like I mentioned, in addition to the health outcome piece of it. So if you're tackling a specific health outcome effort for community well-being, not if, but as you are doing that, because you have to be doing it, you can reflect on more disaggregated data and this concept of targeted universalism to target a specific population in this overall health outcome. So for instance, you might be working towards a systems change around diabetes, and that's really big and broad, but maybe there are like a great disparity in diabetes in Arizona, a certain population, a certain community. That's another way that you could show the health equity lens that you're taking in your work. So we've covered 4 of the 5 criteria. You have to be a coalition working to improve the health outcome using a system change focus and a health equity lens. This 5th criteria is more seemingly logistical, but you, with your budget, have a great opportunity to just elaborate on the 4-page proposal, your 4-page narrative on how you hope to achieve your work. So the budget, as I mentioned, is should total $175,000, which is the max amount for this 3-year grant. As you'll see in the next slide, we have a budget template, and we know that systems change takes a lot of time, even perhaps more than the 3 years of our grant period, and certainly more, perhaps more than our total funding available for our system change grant. So we want to see also the total cost of your system change efforts with other potential funding sources. So in your budget, in the template, and also in your narrative, you have the opportunity to reflect on how you intend on utilizing the 3-year grant of $175,000 broken down year by year, year 1, year 2, year 3. And we want to ensure that the work that you anticipate utilizing the grant funding for is consistent with the scope of work, that you identify the total anticipated cost of systems change. And the anticipated cost is a big piece of it because we recognize that there's a lot of uncertainties, but we work really closely with our existing system change grant partners because we recognize change happens within systems change, and we are amenable to budget modifications as needed to help you continue to achieve your system change efforts. And then you'll have the opportunity to know other possible funding sources as well. So what does that look like? Here is the budget template. And again, this link will be provided to you as a follow-up material. This link is also on the online portal, so you can download it. It's an Excel spreadsheet that does have formulas baked into it, but you have the opportunity to populate the fields and add to the different categories based on how you what expenses you have for your to achieve your system change grant in totality. So you'll see the category around salaries and wages. You might have 3 positions that you hope to have funded or partially funded through this system change grant. So you would just add a row and you can note their name and the position. And then in the 4-page proposal, you can elaborate what specific role that person has, what work are they doing to help you achieve your systems change, and what provide reasoning as to why you included it in their budget. There are different aspects and different categories that have been typical of our systems change grant partners and their budgets. But if you have a category or an expense that's not necessarily reflected on one of these categories, you can either put it in the other section, or if you have a more comprehensive category with other expenses, you can modify the spreadsheet and submit it as part of your application submission, and then provide greater clarity and narrative to the to those expenses as part of your 4-page application. A couple of things I want to note with budget expenses and allowable expenses is Vitalyst does not support capital. So those are the more hard costs that are associated with efforts. Most predominantly buildings or office space and things like that, those like hard costs. We do see that systems change work is heavy on human resources needed. So we have no restrictions on the percentage that can or cannot go to salaries and wages, for instance, or contracts of consultants or whatnot. However, we do evaluate if it seems to be a disproportionate percentage of the total grant, especially if there's a complete misalignment or it's not consistent with your scope of work. And a big piece of this is we allow indirect cost for community-based organizations, but there is a restriction on the systems change grant allowing indirect cost coming from universities on that front, and that's elaborated at the bottom of the spreadsheet as well. So those were the 5 criteria of our systems change grants. This is again just reflecting on the grant application. We have a how-to guide that you can access that reviews the online portal and how to submit it. The 4-page written proposal, those are some key logistical pieces: type, single space, minimum of 12-point font using traditionally used fonts, 1-inch margins, and the accepted file types are there. Try not to get too creative with the 1-inch margins or cramming too much into 4 pages, because again, you'll have to upload this into the online portal. And if you have any questions about the online portal or need direct assistance around creating a profile on there, if you don't have one yet, feel free to email help@vitalysthealth.org. So again, wrapping it all up, the components of your submission due by November 15th to the online portal are to include your 4-page written proposal reflecting on the 5 criteria, the summary of your Wilder collaborative assessment. So after you send a link to all of your core partners and all of them have completed that, you'll receive a comprehensive summary, and that is what you'll upload. You'll ask all of your core partners to draft letters of commitment to reflect on their specific roles and responsibilities and commitment to your system change grant effort in your coalition. So once you collect all of those from your core partners, you can compress those into one document and upload them to the online portal. You saw the budget spreadsheet template. You'll complete that and complete the spreadsheet, and also have the opportunity to provide a narrative of your budget within the 4-page written proposal, since the budget is one of the 5 criteria pieces. And then once we do a review of those, we select those for semifinalists, and there's a presentation component at the near the end of our grant cycle. And November 15th is the deadline. So that wraps up the review of our system change grant and the criteria, the application, and the process. We will stop sharing screen and go to our Zoom, our room here. My colleagues have been watching and following up on the chat room. It looks robust, so let's give it a go. Michelle or Kelsey, do you want to tee up some of the initial questions that were posed there that you may not have answered?
Yeah, sure. One of the questions that we got was when you were talking about tackling the 6 conditions of systems change, the question was, do you lose points for not addressing all 6 of them in the same proposal?
No, not at all.
Perfect. Easy. Another question, and we got this question a couple of times, so I'm just going to raise it. We did address it in the chat, but just wanted you to speak to it as well, is basically, can the same organization or collaborative apply for multiple grant types?
The short answer is yes, but not for the same systems change grant project. So if it's for the same systems change effort, through the discovery intake process, you'll have a conversation with the staff to determine with you if there's a fit, meeting each of the 5 criteria, and the 5 criteria are the same for the technical assistance grant, the Spark grant, and systems change grant. It's just where your effort is in the journey towards systems change. So if your effort is still like in the coalition capacity building phase, we'll recommend the technical assistance grant. If you're in your planning phase, we'll recommend the Spark grant. So that's an individual kind of systems change grant, systems change efforts. If the lead applicant has another systems change effort, you can have a separate conversation so we can explore which one of the 3 grant types might be a good fit, and we'll be able to explore that. I will say I can't think of an example in at least the past 5 years where we've had that happen, especially because we really look at the readiness, the strength of the applicant, the lead applicant, and the coalition's capacity, their strength and readiness to tackle systems change. I know that especially when you have an institutional partner, a college, a government entity, you might be in a better position to kind of approach many different system change efforts, so we can explore that through our discovery intake process.
Okay, thanks, David.
David, another question that came up several times was around governments. Can governments be lead applicants, or does it have to be deferred to a 501c3?
Yes, the governments can be lead applicants. We have an instance down in Pima County where the Pima County Attorney's Office, working with the Defender's Office and community partners, are tackling restorative justice systems change through the county judicial system. So they are the lead applicant, the Pima County Attorney's Office. Of course, when you deal with government and even at the university or college level, there's added bureaucracy. So just reflect on that. Also reflect on the letters of commitment piece of it, which I should have noted. If a core partner is a government institution, oftentimes letters of commitment have to be vetted by by city council's office or legal office, and oftentimes have to be reviewed and approved by mayor and councils. So that, of course, adds to your time frame needed to get that letter of commitment. So if you do have a government entity as a core partner, and certainly as a lead applicant, make sure that you're taking the steps necessary to get those components and that letter of commitment sooner rather than later, because those will be key pieces to your application.
One more question that came up. Is there an allowable indirect cost? I think Amy was looking maybe for a sweet spot or a percentage that or a threshold.
We really don't have a threshold because, again, we recognize that systems change efforts are heavy and they often take human resource, human capital. And that can look like, staff time from lead applicants or compensation for each of your core partners to be part of the coalition, specific roles that different staff members might have. So covering a piece of their salary or hourly rate or fringe benefits. Oftentimes, consultants or coaches or evaluators are a piece of your systems change. So that just adds to your kind of overhead, indirect, or administrative cost. So we've really not set a kind of even a sweet spot percentage or like a maximum, because systems change often takes a lot of those components. So I think as you are reflecting on your systems change and thinking about your budget, let's schedule a time to chat and think through what that kind of sweet spot could look like. Again, there is no specific threshold that we look at. However, if majority of the $175,000, a super majority for sure, is only going to especially one or two staff members, then we begin to question okay, what about other expenses needed to be covered towards your systems change efforts, especially when you're thinking about holding the equity lens with having community at the table, and all the other convening expenses, all the other aspects that go towards research. So we don't have a sweet spot, but that is if it's seemingly too high, that most of the $175,000 will eventually go to those indirect costs, again, like staffing, the fringe benefits, consultants, even maybe like paid internships or fellows or research, university, college researchers, all those kind of examples of indirect cost, that then we would have some questions.
So follow up related to indirect costs, there's a question about you mentioning prohibition on purchasing capital such as buildings, but what about technology like computers or software, tablets, that sort of thing?
Great question. I think that if those items are specifically needed for your systems change effort, then those would be allowable. But I think if it's seen as kind of what the hard part of these more like hard cost is they're used for like just any other kind of nonprofit need or kind of organizational need. So I think it would behoove you to describe, okay, how exactly is this effort or these hard costs being utilized for our systems change effort? So for instance, if you're doing kind of an effort to kind of get community voices and doing community-based action research, then your researchers might need like iPads as they canvass neighborhoods or go to community events to collect that information. I think that effort would be connected to the systems change. But if it's just like buying your office administrator a newer computer, not really attached to your system change, perhaps. And this is again where you insert that cost in your budget, but then in the 4-page proposal, you have the opportunity to provide clarity and a bit more narrative to your budget. Amy, I see your hand raised, and then we can continue in the Zoom room questions.
Thank you. I was trying to write it in the chat, but for some reason I couldn't get it to send and it got very complicated. So I thought maybe it was just easier to ask. So I'm trying to understand because I'm the grant writer. We have a coalition. We're already working on a project that is systems change. I'm excited. It sounds like a great fit. However, everybody who is employed consumes resources within the organization. So typically when I write grants, there is either a direct line item or an indirect rate, which covers things like all those things that nobody sees, like the cleaning and the alarm and the telephone and the internet and the office lease and, you know, just all those things that we are required, like we have, if you're going to go in your house and take a shower, you have to have water. And so it's great to have money for food, but if you can't take a shower. And so in our workspace, like we have employees that have to use the copier and have to use the internet and we have to have our alarm system and those things. So does this grant only fund actual hard costs of a project such as staff, benefits, do they cover mileage, you know, paper, incentives for community members or stipends for community served, those things going out, or is there any infrastructure like the support to actually run the program? And that was my question about indirect, because like a lot of grants will have a 6% or 10% indirect or a provisional that's based on salary. So I'm trying to wrap my head around how do I can write the grant, I can do the program. We've got, you know, all kinds of collaborating partners. The organization is going to ask, okay, who's paying for the electricity?
Exactly. Yeah, totally understand your question. And before I answer it, I recognize it's just past the top of the hour, and we allotted an hour for this. If you have to drop off, quite all right. We'll keep recording and send this recording and the materials to everyone that registered for this session, and we'll post it to our website and social media as well. So if you have to drop off, no worries, we still got you, but we'll continue to record and answer questions live. So Amy, to your question around the percentage budget line item for indirect cost, we do allow that. So you can account for just a general percentage for indirect administrative costs, all of those aspects that you highlighted. In addition, we also allow those specific categories around salary and wages, consultants, fringe benefits for the specific people or activities that administrative cost directly connected to the system change effort.
Thank you so much.
Yeah, thanks for the question, Amy. If you have questions, feel free to raise your hand and we'll call on you. But Michelle, Kelsey, Sergio, any other questions from the Zoom room?
One question I was about to answer is asking if we mention rent when saying no capital purchases. So do we consider rent a capital purchase?
That's a good one. Again, I think that I don't think it would necessarily be a capital purchase. If it is a component that is helping advance your systems change, I would say you can allow it, but it would be very, very important for you to elaborate in your 4-page proposal as you discuss and narrate how your effort is meeting the budget criteria, to specify how that rent expense is helping you achieve your systems change. And in this instance, it might actually be better if you include that percentage in as part of your indirect cost, perhaps.
Thank you, David. That's it from the chat.
Awesome. Well, we will be downloading the chat and the questions and providing the answers that we covered here as part of a kind of FAQ document that'll be included as part of the follow-up materials. Again, we have this recorded. We will share it out along with all of the links and the materials that were presented in the session today to via email and then post at vitalysthealth.org. Again, we have an open door policy, so we highly recommend if you want to talk through your systems change potential and effort, please go to vitalysthealth.org and our partnership webpage to complete the discovery intake form. Once we receive that, we review it, and then you will receive a follow-up prompt to schedule a time to chat with one of the Vitalyst team members to have that one-on-one conversation. Our portal opens next October 1st, and applicants have until November 15th to submit their systems change grant submission to the online portal. If you have any other questions, don't hesitate to reach out to us. Thank you all so much for your time today.
Thank you.
Thanks so much.